We now know that Infoway was paying millions of dollars to PR firms, and not just any PR firms. PR firms, well, let's just say they have a lot of liberal participation. Canadians were justifiably concerned when the Liberals began shutting off the cameras at committee, preventing the public from seeing exactly what was happening behind closed doors. However, our position was the opposite. The meetings where the Liberals suddenly moved into camera and prevented Canadians from seeing what was going on at these committee meetings were inadvertent bullseyes that tell Canadians exactly where they should be looking. In this case, the Liberals shut off the cameras during the PrescribeIT investigation. And the deeper we dug into Canada Health, the more obvious the reason became. Let's take a look. Ladies and gentlemen, I present to you Canada Health Infoway. Canada Health Infoway was an organization that was started back in 2001. And the whole goal of this organization was to help innovate the Canadian health sector and look at digitizing many of these systems and solutions that were actually in place across Canada. Now, it was founded under the previous Liberal government before the Harper government took over, and this is how it was structured. So you have the Minister of Health, who's the elected official that is in the cabinet for the government at the top. Then under that, you have Health Canada reporting to them, and under Health Canada, that is headed up by the Deputy Minister, the equivalent of the President and CEO. And then under them is the Assistant Deputy Minister, or a Vice President, if you will. So then they structured Canada Health Infoway. Now, it's not a Crown corporation, so it's not a government agency. It's an arm's length agency, just like the SDTC was. And we all remember how well that worked out. And how that was structured is you have a board of directors, and there's folks from the provinces that are in there. There's government officials. One of those government officials that is present on the board of directors is the Assistant Deputy Minister in Health Canada. And then you have some independent directors from other portfolios that are outside of the organization. And all of that is headed up by the president and CEO. And then under the president and CEO, that's where you have the executive team, the workers, and everyone else in the actual organization. And they all report into the board. So you have the Canada Health Infoway organization, who's supposed to be delivering better health solutions for the Canadian health sector, who reports into Health Canada, who reports into the Minister of Health. So before we get any further, so Canada Health Infoway was given roughly around $2.1 billion between 2001 and 2015, 2016. Now, the whole point of that was, as I said, to help digitize Canada's health sector because, well, let's just face it, Canada's health sector is pretty antiquated. You may go into some hospitals and see some pretty impressive gear around, but the majority of the administration actually is pretty antiquated. I used to work in the health sector on 2 different occasions, and we were still dealing with clinics and doctors that were still running Windows 98. It's not because they couldn't afford better gear, it's because they didn't want to move. They got used to something, and they were comfortable with it, and they didn't want to spend time or energy or money upgrading or training. So that's an issue. Now, most of that time, Canada Infoway, or Canada Health Infoway, I'll just call them Infoway going on further. So Infoway decided that they needed to help transition the entire medical industry onto the electronic health record. So what is that? Well, in order to understand what that is, we also need to talk about what an electronic medical record is, because all of this is going to become very important when we get to PrescribeIT. Ladies and gentlemen, EHR versus EMR. So EHR is the electronic health record, but let's start at EMR. So an EMR is electronic medical record. This is used by a single provider. So when you are in your doctor's office and they do some sort of checkup on you, they will essentially generate an electronic medical record. This is if this doctor's office is actually using this technology. So they'll put it in the computer, and then that becomes your diagnosis. Now that they have generated an electronic medical record. So it's a distinct moment in time or one distinct artifact related to your health. Now, let's get to the electronic health record. The electronic health record, this is the totality of who you are. So this has any potential diagnosis, any potential medication that you're using, and any treatment that you're in. So this can be advantageous if you're in a secure data type of environment and everybody trusts everything, because what you could have is, let's say you're on a trip and you're over in New Brunswick, you're unconscious, you go into the hospital, all they have to do is scan your driver's license or something like that. Up pops your medical history. They know what your allergies are. They know what medications you're on. So they could potentially avoid prescribing something that would be a problematic medication, cause an allergic reaction, that sort of thing, and also fit within the ecosystem of drugs and medication that you're currently taking. So that could be a good thing. Here's the issue. Getting physicians and clinicians and the entire health sector to use electronic health records and electronic medical records is an extreme challenge. There was the eHealth network in Ontario that was underway for many, many years. I worked for a laboratory company that was part of that, and we had what was called a LAS, or a laboratory information system, that collected all of the results of all of the different clients that actually came into our labs. So if you go into Dynacare, Life Labs, or any of these other labs, all of that information gets put into a laboratory information system and then gets transmitted to the lab, and then they know how to process your sample, and then that gets transmitted back to the doctors and everything. So that's fine. So Infoway, they made it their mission to try to get adoption. They tried to convert as many clinicians and as many different aspects of our medical system that there are onto this electronic digital record. And it didn't go well. To see how well it went, we're actually moving forward 15 years to their annual report for 2015-2016. So here's a snapshot. Now, one of the things that you can see in here, so we're 14 years into this project, right? $2 billion in. And one of the key risks to their operation that they see is number 3, you can see clinician adoption risk. That is something that they are highlighting very clearly. So that's an issue that they've been dealing with for over a decade. You'd think they would have solved that issue by now, but they haven't. Here's another page from their annual report. Infoway has received $2.1 billion through 5 separate federal government grants since 2001. These funds have been used to co-invest in 419 projects with the provinces, territories, and other partners. So this gives you an idea of how much money they spent. And over here, you can see a majority, more than 257,000 of health system professionals, doctors, nurses, pharmacists, other clinicians, and administrators are now using electronic health records. This includes provincial, territorial EHRs, access to 2 or more clinical domains, etc., and single clinical domains. This represents more than half of all potential EHR users across Canada, estimated at 500,000. Yet here, you can see it says more than 11,000 patients, family members, and caregivers are currently enrolled in 7 consumer health demonstration projects across the country, and collectively they have used these solutions nearly 119,000 times. So you've been doing this for 14 years. You've received $2 billion of taxpayer money, and you're saying that only half of all participants, meaning clinicians, pharmacies, hospitals, etc., only half are actually, using your service. But that means they've used the service. That doesn't mean actively using the service. And we're going to get to that in a minute. And then they go on to say, 11,000 people throughout the country have used this service out of 40 million. Well, it's 2014 at that time, so let's give them the benefit of the doubt. Let's say around 36 million at that time. That's not a lot. So this is important context, because what they're saying is many of their projects that they're launching and trying to get clinicians to move to a digital format aren't working. Now, this is critical, because at this point, it makes moving to something like PrescribeIT completely insane. Because PrescribeIT, the whole point of that is, so you go to your doctor, they take your statement, they diagnose you, they write a prescription, they enter that into PrescribeIT, and that sends it to the pharmacy. That's the whole point of this. They can do this already with their own technology. They can do this already with a paper and a fax, but this is the solution to get them into digital. The issue is they have to be on digital in order for this to actually work. So if you can't even get over half of people to convert to a digital format already, how are you going to get them into PrescribeIT? This becomes the core problem. But they decide to do this anyway. So that was their 2015-2016 report, which doesn't mention PrescribeIT, by the way. But in late 2016, an RFP goes out. Infoway calls for e-scribing proposals. Canada Health Infoway has issued a call for proposals for a $40 million national electronic prescription service called PrescribeIT. Service would connect clinicians and pharmacists so prescriptions could be issued electronically. So this is the actual call for this. Now, there's some criticism that actually comes at this right out of the gate. Infoway has already spent nearly $200 million on an incomplete system of provincial and territorial drug information systems designed to capture complete records of patients' medical usage. Infoway says in its 2015-2016 annual report that drug dispensing profiles for 69% of Canadians are now available for access by authorized clinicians. However, Infoway financed drug information systems were available in only Prince Edward Island, Manitoba, Saskatchewan, Alberta, and British Columbia, according to a 2014 Harris Decimus survey conducted for Infoway and the Canadian Pharmacists Association. In these 5 provinces, 91% of the 447 community pharmacists who responded to the survey said they never accessed prescriptions through these systems. The survey also showed that despite Infoway's investment of at least $700 million in interoperable electronic information systems in clinics and hospitals, clinicians almost never sent prescriptions electronically to pharmacists. Nobody uses this system. It's a cultural issue. So their annual report says, oh, well, look at all these people. They're on our system. They may be on your system, but they're not using your system. And that's 2 different things. So this RFP goes out to the criticism of the medical community. The RFP went out on September 6th, 2016. 16 days later, something else happened. What happened, are you asking? Well, let me show you what happened. Ladies and gentlemen, what happened was Telus Health Solutions GP for the first time began lobbying the federal Liberal government. And they began lobbying them in late 2016, once this RFP went out. What did they talk to them about? Well, they talked to them about this. Now, it doesn't say PrescribeIT in here anywhere. But what it does say is they're talking to them about Aboriginal affairs, economic development, government procurement, and health. Isn't that interesting? So right after this goes out, Telus starts lobbying the government for general reasons. Now, you might just say, well, this could be a coincidence. Was it though? Because 4 months after they stopped lobbying, because they began in October and they stopped in January, and 4 months later, this was announced. Telus Health selected for PrescribeIT. Canada Health Infoway has recently announced that Telus Health has been selected as the successful bidder for the technical solution provider for PrescribeIT. And it says some more, but it also says read the news release to learn more. So when you click on that, oh, that's interesting. It's not there anymore. Well, unlucky for them, there's something that we have access to, which is the Wayback Machine. So ladies and gentlemen, this was the actual press release that was out by Canada Health Infoway back on May 11th, 2017. And so what they go on is to say this: as a long-standing technology provider enabling improved health outcomes for Canadians, we are proud to be working with Infoway to develop and operate PrescribeIT. PrescribeIT will be built on our open, interoperable, and vendor-agnostic Telus Health Exchange platform, which is already enabling collaboration and efficiency in the primary care ecosystem, said Paul LePage, president of Telus Health. Quote, we look forward to advancing this service in support of driving better health outcomes for Canadians and helping to bring PrescribeIT to patients as soon as possible, end quote. So this is interesting because Telus is kind of positioning their technology here as open, like open source. That's kind of what I read from that. And they said it's vendor agnostic, so it's very easy to integrate. Well, let me tell you, for being in IT for 20 years, the words that I fear the most when I'm talking to a vendor is agnostic, simple, fast, and easy. Those are the words that cause me the largest red flags. Because, as we're going to find out, this wasn't open, this wasn't easy, and this wasn't exactly vendor agnostic. And we find that out because Telus actually kind of realized something after getting this bid. And the one thing that they realized is because the government is going to be funding Infoway, that is going to be funding Telus, who already has this technology, and they're in the same technology space as many other vendors out there, this gives them an unassailable market advantage. This can potentially lead to a path of a complete monopoly over the health digital market for Telus in Canada. Because if Infoway has chosen you to create the national standard and the national platform of which all of these digital health records are supposed to be going into, what is everybody else supposed to do? That's the big thing here. Canadians are effectively funding the creation of a monopoly in our healthcare sector. And that's not a good thing. But Telus realized this, and they wrote a submission to the Competition Bureau. And they submitted this on April 8th, 2021. And this is what it says. To reap the full benefits of interoperable digital health solutions, a high level of adoption among different healthcare professionals and healthcare settings is required. So Telus is saying that. For example, the e-prescribing solution built on Telus Health technology and delivered through Canada Health Infoway, PrescribeIT. While this e-prescribing solution presents an opportunity to integrate primary care prescribing with pharmacy fulfillment, it faces adoption challenges because e-prescribing requires that the EMRs and PMS, that's pharmacy management systems, are compatible and integrated with the e-prescribing solution. And the decision to integrate such systems with the e-prescribing solution rests with each pharmacy and medical clinic. So, ladies and gentlemen, this is 4-5 years later. And Telus is saying that there's problems. They're saying there's problems with adoption. The same problems that Infoway talked about before even starting this project. Now, there was $300-ish million allocated to this project over 5 years. So Telus at this point has already received about $40 million because they're getting roughly $10 or $11 million per year for this. And they're saying this is built on our technology. And it's not really our issue with adoption. We just provide the tech that was already built in the first place, by the way. So most likely what they were asked to do is to create a presentation layer that we say. So they actually don't have to build the e-prescribing solution. They've already had it. And they had it before they even won this contract. So what are we actually paying them for? That's the real question here. And what about all the other money? So obviously things weren't going well because late in 2024, PrescribeIT, which is run by Infoway, is actually announcing this on their website. Pharmacy fees for PrescribeIT to begin January 1st, 2025. Starting January 1st, 2025, Canada Health Infoway will introduce a transaction fee of 20 cents for each new and renewed electronic prescription processed through PrescribeIT. Well, let me tell you, if you're trying to get a bunch of people to buy into a system and you're already having trouble, this isn't going to go well. And it didn't. CPHA urges pause on PrescribeIT transaction fee that will threaten the sustainability of Canadian pharmacies. So what this press release is essentially saying is, we're gonna stop using your product if you actually do this. Over 65% of the people that actually did use it, of the fraction of people that were actually using it, they're saying, we're not going to use this anymore if you put in this transaction fee. That's a problem, folks. This was doomed from the beginning. And you had the company admitting before it even issued the RFP, request for proposal. The company is admitting that clinicians aren't even using the digital health records, never mind a system that is supposed to then use them. And now you have this going down in flames. So what happened next? Well, what happened next happened this year, February 12th, 2026. PrescribeIT being shut down due to low adoption rates as Infoway looks to promote open e-prescribing standard. This is on their website. So they're basically saying, so yeah, we're shutting this down and you have until the end of May. So you better get off of this. Sorry, everybody. That's unfortunate. Now, ironically, on that same day, Globe and Mail put out an article. Doctors are still faxing prescriptions in 2026. Ottawa's $250 million program to change that was just shut down. Despite the number of providers on board, use of the service has remained low. Less than 5% of prescriptions are sent electronically in Canada each year, according to reports from Canada Health Infoway and Telus Health. That is abysmal, folks. This is 25 years after Infoway began its quest to move people over to digital. They wrote another article not too long ago. Canada Health Infoway, the nonprofit behind a failed $300 million digital prescription program being probed by MPs, spent more than $400,000 on executive travel and $23 million in contracts to consultants in under 3 years, public disclosures reveal. More than $147,000 of that travel was taken by Michael Green, the former chief executive who was dismissed last week and who Infoway disclosed was making nearly $900,000 per year. So that's the fascinating thing. It became public knowledge that Michael Green was making $900,000 a year, and when people started asking, why is that? All of a sudden he was dismissed. Now here's the problem. So he's making $900,000 a year. If he's dismissed, he's going to get a nice, hefty severance package with that too. Who knows how much more money he got as a part of that? Because usually with executives, they come with pretty swanky severance packages. Top 8 Infoway contractors in total contract value. Accenture, $2.76 million. InQ Consulting Corporation, the App Lab, Sussex Strategy, and you can see the rest. So there's a bunch of them there. Now, there's a reason that why they're there, but we're going to get back to them in a minute, because I want to start here. So these are the pharmacy management system vendors. These are the people or the companies that actually build the systems that pharmacies use to manage their prescriptions. Okay? These are listed as partners on Infoway's website for PrescribeIT. These are the electronic medical record or health information system vendors that are listed as partners on Infoway's website as well. So these are the different companies that build systems for clinics and other medical professionals to use to actually create or write an electronic medical record like a diagnosis or something like that. And here's the retail pharmacy partners. So you can see everything from Walmart to Shoppers Drug Mart to Rexall, PharmaSave, and everything in between. Now, why am I talking about these? Well, because it's very likely that a company like or organization like Infoway trying to get adoption and trying to get all these people and companies to use their system would have had to pay them money. And they actually admit it because they say on their website that their partners, they actually provide incentives and support to support the integration with their systems with PrescribeIT. So we were asking, okay, so Telus took around $100 million of this $300 million, right? So where did the other $200 million go? Well, a chunk of that would have gone to all of these corporations and would have gone to all these companies that are building these pieces of software as integration fees. Remember the vendor agnostic platform that was supposed to be really easy for vendors to integrate with? That was part of Telus's RFP. So why is Infoway having to pay all of these different vendors integration fees? That's what we want to know. But over and above that, we go back to that other graphic that was cited in the Globe and Mail article, and you'll see Sussex strategies and Crestview strategies. So ladies and gentlemen, we're now at the point of the video where if this wasn't bad enough, the Canadians paid $300 million for something that didn't work. Sounds a lot like a Rifecan. $100 million to a company who already had the technology built, so we were wondering what they were actually doing. We now know that Infoway was paying millions of dollars to PR firms, and not just any PR firms. PR firms, well, let's just say they have a lot of liberal participation. Ladies and gentlemen, this is Parker Lund, Vice President Communications and Campaigns for Sussex Strategies. Why are we talking about him? Well, because before joining Sussex, Parker played a key role in Mark Carney's 2025 federal election victory, serving as the Liberal Party of Canada's Deputy Campaign Manager overseeing national communications and messaging. From 2022 to 2025, he was the Liberal Party's communications director, responsible for executing the party's 2023 national convention and its 2025 leadership race. Gee, I think Mark Carney ran in that leadership race, don't you? He previously served in Prime Minister Trudeau's office, supporting communications through the COVID-19 pandemic, Canada-US relations, and various government announcements and milestones. Ladies and gentlemen, this is Dan Lavelle, Vice President Federal of Sussex Strategies. Why are we talking about him? We'll zoom down to the bottom there. Dan has served as Golden Horseshoe Regional Chair for the Liberal Party of Canada in Ontario. Let's shift over to Crestview Strategies, folks. This is Bridget Howe. She's Vice President. Now, why are we talking about her? Well, you can probably guess. She has worked on several election campaigns, was a local campaign manager for the 2025 and 2021 federal election campaigns, and the lead monitor in the 2019 Liberal Party War Room. Additionally, Bridget worked for members of Parliament and the Liberal Research Bureau. Not to be outdone, this is Lucas Borchenko. Lucas has a passion for bringing people together. I'm sure he does. He also worked for a member of Parliament and participated in election campaigns in the 2019 and 2021 federal elections. Lucas is a past member of the Liberal Party of Canada's National Executive Board, serving as the National Chair of the Young Liberals of Canada. Lucas recently held senior roles in the Ontario Liberal Party's 2023 leadership and presidential campaigns. And here's Wesley Boyd. Why are we talking about Wesley Boyd? I'm sure you know why. An experienced organizer, Wesley was a member of the Mark Carney leadership campaign and the 2025 Liberal Party of Canada national campaign team, serving as the Get Out the Vote director for the Prairies and North. He also held leadership roles in the 2015, 2019, and 2021 federal election campaigns. And it goes on, folks. Here's John O'Leary, and he was involved with the Liberals. This is Christine McMillan. She was involved with the Liberals. This is Connor Coles. He was involved with the Liberals. And Hunter Nifton, and he was involved with the Liberals. Why does a supposedly nonpartisan and independent organization that has received now $2.4 billion, why do they need not one, but two liberal public relations firms? Why are two public relation firms for people that worked on the Liberal campaigns? Why are they getting millions of dollars? These are the questions that Canadians would like to ask. And these are the questions that Canadians want to ask on camera. So is it no doubt that shortly after this information started trickling out, this happened?
I move that the committee request that the Auditor General of Canada conduct an audit of PrescribeIT, including the costs, governance, termination, transition, and intellectual property arrangements. And B, invite the Minister of Health, officials from Health Canada, and the Treasury Board Secretariat of Canada to appear for at least 2 hours on PrescribeIT.
We look forward to working together all around the table with you and looking forward to your guidance on our committee. With that, I move to have the meeting in camera.
So the Conservatives called for a motion for the Auditor General to investigate, for the head or the Minister of Health to come and testify. This was right after the Liberals gained a majority in committees, and they shut it down. So, ladies and gentlemen, this could be a huge signal as to what we should be paying attention to right now. There's a lot of reasons that this project, that this initiative, is far worse than ArriveCan. Never mind the fact that it's 5 times more expensive. We're over $250 million of money that have been flushed down the drain by a Liberal government. But we now have proof that we have organizations full of Liberal insiders that are directly benefiting from this alleged arm's length organization. So this video, this isn't the end of our investigation into Infoway and PrescribeIT. Ladies and gentlemen, this is just the beginning.